Hello there, Nachi Sinha here. Welcome to Sitting with Sinha. Today we're going to talk about somebody who's had a very important role to play in healthcare, um, not just in New Brunswick, but also in the larger scheme of things. And it's a unique thing to be able to be in a situation where you get to see behind the scenes what happens, and also get to play on the role in policy making and actually make a big difference, and on an entire basis. We're going to talk to the current CEO of the New Brunswick Medical Society, and allow me to introduce you to Mr. Anthony Knight. Hello, Mr. Knight. Anthony, of course, you're now live. Call me Nachi.
Hi, Dr. Sinha. Nice to see you. Of course, Nachi.
Excellent. So thank you for doing this, Anthony. I mean, I was just briefly mentioning how, what an important behind the scenes sort of, and actually not even behind the scene, very much in the scene, except the public perhaps doesn't get to see that side of the scene, a role that that you play as the CEO of the Medical Society, or New Brunswick Medical Society. And I think it was important to sort of have a conversation around that, especially in light of how things have been and with all that stuff going on, the COVID and all that stuff, of course. But before I do that, I mean, would you like to just tell us for the sake? I mean, I of course know you, for disclaimer's sake. I mean, I am on the executive board of the New Brunswick Medical Society, so. But I'm sure others would also like to know how what your role is, and what the medical society is as well.
Sure. Well, I'm a chief executive officer of the New Brunswick Medical Society. We represent all physicians in New Brunswick. There are roughly 2,300 members who are both active practicing physicians, retired physicians, and of course, medical learners who are either medical students or residents from all corners of the province. We perform a number of functions for physicians, including providing representation when it comes to the remuneration of physicians, as well as providing programs and services to support doctors in their efforts to provide the best possible care for their patients. That includes things like their medical liability protection coverage, parental leave, supporting continuing medical education. And then we also provide important services around wellness and keeping our physicians well. And of course, we all know the notion of when the plane's going down and the face masks are dropped, it's important to put yours on first and then look after the person next to you. So taking care of oneself is a really important focus of our organization. I've had a really great pleasure in working for New Brunswick's physicians over the last 12 years, and it's been an extraordinary experience, a way to learn about the critical role physicians play in our system, but also what the New Brunswick Medical Society can do to influence, to guide, and to support those who are doing their best on the front lines to deliver the best care for their patients.
Right. No, you're right. I mean, and yes, I mean, there have been some important initiatives that, especially in the past, a few years, in the context of how things have been for physicians and how medical society has reached out to look after the well-being of physicians, of course. How did you sort of get into this idea of getting involved in something like this, right? I mean,
well, I have a career of working with and supporting not-for-profit organizations in a leadership role. I started working in government, in fact, for a advisory council to the premier, focused on youth, and I did that right out of university. Following that, some other government agencies, as well as a Chamber of Commerce. And the common theme is, of course, working for a board of directors, senior volunteers, active people in the community, and trying to advance a cause, whether it's young people, public libraries, the business community, and now medicine. That's certainly my expertise in trying to give a voice to people who want to be well organized, to have a focused cause and a raison d'être to explain, to express to government, to influence government, and to, at the end of the day, make a difference for the various constituencies that were involved in organizations I've been a part of.
Right. I mean, one of the things I've noticed about, medical society, of course, I mean, because it sounds like, okay, we're about physicians and so on, but a lot of stuff that was happening, of course, has also been around public information education, right? I mean, I know that, you and your colleagues at the medical society have strongly felt about. I mean, you brought it up numerous times at the board, and of course, the board has been supportive and so on. I mean, do you want to talk a bit about how much of a, of a core apart from being by the physicians, also been about public education on important matters?
Well, certainly when I joined the medical society, that was a message that was loud and clear that physicians were looking to use their professional association as a point of good information, as the true North Star for healthy living, for well-being, for good eating, for supports for those who are more vulnerable than others,
Mhm.
who may not have a voice for themselves. So all of those themes and core principles guide much of the work we've done over the last number of years, whether it's supporting Heart Health Month, encouraging people to choose good nutrition, active transportation, road safety, safety on the ski hills and snowmobiles, um, cannabis use with its legalization.
Yeah.
We were certainly
Yeah.
very active there, providing resources and tools to parents, to educators, to physicians who are having conversations with their patients, all in the effort to provide sound, reasonable, easily digestible information for patients in a world where there is so much information and
Yeah.
it's so challenging to discern whether you can trust that source or not. So we really sought to position ourselves as a trusted source, as a leading source and a voice for
Right.
physicians, but also the perspective that physicians observe in their clinics each and every day from the
Yeah.
point of view of a patient, and advancing that through our government relations efforts or our public campaigns, as you mentioned.
Yeah. I mean, and again, I mean, seeing that happen and I know a lot of positive feedback coming back, that must be quite satisfying.
It is. We've certainly demonstrated that there is a level of trust, and also a level of citizen engagement that we've built that wasn't there in the past. And the citizens are also not afraid to challenge us as to whether the doctor's always right or not. So
Yeah.
we're always actively engaged
Yeah.
with people, with New Brunswickers and elsewhere about critical issues. And it's a constant conversation that we're having with the
Mhm.
citizens of this province about how to live well, be well, and have a great, high functioning health system.
Right. I mean, you're right. I mean, it is I mean, and I noticed that myself. It's just a very sort of two-way thing, not just with the general public, but also with physicians as well, right? I mean, because it's sometimes, I mean, you know it, of course, and I know, but sometimes, one tends to forget that there's a side of physician that is beyond, the person who's looking after somebody, right? And you use the analogy of the plane thing and put the mask on, and you're right. And yet, the funny thing is that that announcement has to be made every single time, right? I mean, logic dictates that once I heard it, I would get it because they're looking after me. It has to be made every single time. And I bet there are still moments where people still don't do it. I mean, and I guess the same thing works with physicians, right? I mean, it's, medical society has done a lot with all kinds of wellness programs and providing emotional and, physical support and so on. What do you see as apart from good old stubbornness in the part of physicians? What is it? Do you think that it kind of? I mean, the phrase, for example, physician heal thyself, right? What do you think stops that from happening?
Well, I think anyone in a highly demanding role, as similar to a physician, struggles with maintaining whether it's work-life balance, healthy eating, physical activity, mindfulness, and maintaining that balance. Relationships with family and friends that are strong and stable. Many physicians do very well in all of those respects, but some are challenged, like many of us who are not physicians. And I think it's despite knowing all the facts and science behind the benefits of all the
Yeah.
things I just mentioned, finding the time, the energy, and battling the remnants, the ghosts of clinical practice, I think is certainly a factor. Um,
Hmm.
I've talked to doctors who've struggled after an outcome from a case that wasn't anticipated or was a negative outcome.
Yeah.
And that's something that I know doctors carry with them for the rest of their days.
Yeah.
And that's not something all of us who are non-physicians or not in the healthcare system have that same experience. Certainly first responders would have that similar experience,
Hmm.
but it's a rare challenge that many physicians are faced with, and so that's why we have taken so many steps to provide a safe place for physicians to come forward, to share their experiences in a trusted environment where they can relate their experiences and hopefully help to process the emotions and the challenges associated with that without
Yeah.
turning to any sort of negative behavior to help cope with those challenges. So it's complex to support such a high functioning group
Hmm.
that knows many of the very important and critical steps that we all need to take to be well.
Right.
But we certainly do our best to reach out and to
Yeah.
provide
No,
that
you're
support.
you're right. I mean, it is challenging. I mean, for example, even just I mean, and again, everything that goes on together, just not just being a physician, but like you said, different aspects of one's lives, right? I mean, because the problems that a person normally faces, those problems are also faced by physicians, and on top of that, there's another layer and so on. So that obviously adds more layers to it. And I'm not talking about poor physicians or poor. I'm not trying to do a pity party thing here, but just to kind of understand that, of course. Now, the interesting thing though is that now that you know we all know that the medical society cares about us physicians. I mean, people call, right, and ask for help and so on. So, I mean, how does your team? How do you cope with going through? I mean, you have a life too, right? Your team has had the same struggles through COVID, I'm sure, as everybody else has. On top of that, there's this huge responsibility which has been thrust upon you and your team about trying to do something sometimes where things can't be done. For example, in
Mhm.
COVID, where the emotional expense of how it has been for physicians. I don't mean the medical side of it. I mean the emotional suffering. But all that has been offloaded on you and your team, I'm sure. So how have you guys managed?
Well, we're fortunate that we have a very resolute, um, balanced team. We provide, uh, really valuable supports to our employees, whether it's a flexible work environment, which was first of all foisted upon us by COVID, but now as we look to maybe see the end of the pandemic or approaching endemic, we'll continue to offer flexible work environments, which I think a lot of our employees value. We also provide excellent benefits and services, whether it's counseling for themselves or their family members. That I think if people are struggling, then they know there are resources that are there. We also provide, I think anyway, a really collaborative, supportive, open
Yeah.
environment for our staff and our team members, where people can talk to one another, engage, and feel like they're a part of something. And that's been a really challenging thing to
Yeah.
promote while so many of us have been working remotely. So really fostering the team and the team element of being together We do through, large group chats, wellness challenges where
Hmm.
folks are working out for the month of March, for instance, or when we could be together in the earlier fall, hosting smaller group events, all in an effort to give people a sense that they're part of something, because they are, and they're
Yeah.
part of something that's important, that makes a difference for our members.
I mean, no, you're right. I mean, through the challenging times, I've always found, and I'm not saying this to you because you're here right now. I mean, I'm sure people have heard me say that before. I always found you and your team to be, to be there, and sometimes, especially when the physician, when one is going through their own stuff, sometimes people don't know where to reach out to, and that's where, in the past few years, I mean, I've seen how the medical society took the lead, right, in coming up with these wellness sort of projects, right? I mean, even before the COVID thing, I mean, you were sort of ahead of the curve, so to speak. And do you find that these physician and wellness initiatives have a good sort of uptake amongst physicians?
Yeah, I think we've increased our utilization by 500% since
Wow, wow.
2016. So the use is exceptional. We have a network of psychologists that we've contracted to provide their services free of charge to doctors and their families all around New Brunswick, both official languages, at hours that meet the schedule and the
Hmm.
demands of on time that physicians face. We also provide things like matching a physician with a family doctor to ensure they have good access to primary care,
Wow.
um, and creating events and sessions on wellness. We've been hosting those for some time, and continue to as well. And I think that all really helps to build and support and promote a culture of well-being, of thinking
Yeah.
about your well-being, and considering others too, which I think is really important. Once you do have that mask on your face, you
Hmm.
should check others around you to make sure they're
Right.
okay as well. And
Yeah.
I think we all have a responsibility to not only check in on each other, check in on our neighbors, but also be kind to our neighbors. And I understand we don't always know what folks are living with or living through at home or with themselves.
Yeah.
And being that supportive ear and that kind stranger, I think, can make a big difference in our
Hmm.
communities.
No, 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 you're right. I mean, it's definitely definitely true. One of the things that when people talk about physicians and New Brunswick, of course, I mean, one of the things that comes up is the struggle around recruitment, right? I mean, and I know that that's a cause very close to your heart, and of course, discussing the board and your team as well. I mean, everybody has kind of worked together towards sort of making it priority, that sort. I mean, what do you think? I mean, have been the challenges that in recruitment, keeping in mind that we do live in a world that's increasingly global, and if that wasn't the case before, now it's more because you can connect to people. People are used to now connecting over the internet, I guess.
Yeah, it is a complicated, problem. It's a wicked problem, in fact, because there are so many elements to try and get your hands around and understand. First it begins with our training institutions and making sure that we have the right number of medical school seats
Hmm.
for our population today and for tomorrow. And I think there's could be some more work done in terms of planning for what our future needs are as it relates to primary care and our specialties. In addition to that, we need to think about residency programs. So for those who aren't in the medical field, you do 4 years of medical school and then proceed onto residency, depending on whether you're pursuing family medicine or specialty. This can take between 2 and 7 years of education, depending on your
Yeah.
area of interest. So that's a long time to try and plan and understand when and where an individual will land once they've completed their training. but we need to create pathways that are clear, seamless, and make it easy for someone that is interested in working in New Brunswick to do so. And there are certainly some structural, organizational, bureaucratic structures that simply aren't nimble enough. They aren't rapid in their response. And there's not that entrepreneurial edge to seek out individuals who would like to provide healthcare in our province. So I think there's a number of things there that could be done. And then finally, I would say incentives matter to a certain degree. We want to make sure that early graduates or new to practice individuals have access to the right incentives, whether it's associated with starting a practice, which is a big investment, as you know, Nachi, or helping to pay off debts that are associated with their medical training. So those are all things that I think play an important role. And we're having, I think, productive discussions with our provincial government on the subject of many of those issues.
And that's important. And I'm glad you pointed that out, because throughout the process, the government has always been an important partner in everything that, the medical society and physicians and healthcare in general that's happened in the province. Now, let's say that I'm a patient, and not a physician, not a part of the medical society, and so on. And I'm listening to this, right? And I'm hearing all this nice stuff about what's being done for physicians or for physicians, even though we know that as physicians, they've been suffering of a different kind. I'm going to talk a bit more about that in a bit, but as a person who's listening to this, what is the medical society and the physicians of New Brunswick? How they're making decisions that benefits me. Now, I know, if I step back a bit, and as somebody who's been on the board, I know about the fantastic programs like the initiatives with the Family Medicine New Brunswick thing, right? The initiatives that, for example, through the COVID period, when the medical society sort of found ways to make sure that basic PPEs were present and so on. At the end of the day, all of this obviously helps access. But as a patient, I don't know that. I don't know what you guys are doing for me. So could you tell me why I should think you care as a patient?
Well, that's a great question, Mr. Patient. I think, as you said, we know how important access to primary care is. That's why we launched the Family Medicine New Brunswick program that you mentioned, which enables doctors to work in teams. They provide access after hours. They use a common EMR. They can hire and bill for a nurse, which other physicians cannot do. That's through Medicare. There's types of supports there for those physicians to do data analysis on their patient panel, and to see where they could maybe enhance their efforts, whether it's a group of patients who are diabetic or otherwise. So we think that's a really important thing that we're doing.
Yep.
We also spent a lot of time trying to get doctors to adopt electronic medical records.
Yes.
Back in 2010, we were one of the worst in terms of adoption in the country. And after about 10 years, we certainly moved the needle. We didn't get to certainly the top level of EMR adoption, but we made a difference. And we tried to make it easy for doctors who are unsure which record system to use, that there was a clear path and there was a way to do it efficiently and cost effectively as well. I'd say the third thing just around the pandemic is, trying to convey the right information at the right time to doctors was a really important function we played. You also mentioned the distribution of personal protective equipment during and throughout the pandemic. That was done in collaboration with the province of New Brunswick. They provided the materials, all the materials, for free, and we managed the distribution and shipment and managed the costs as well. Those are things that happen sometimes in provinces, but not always. And having a really solid, productive relationship with our government made a big difference in making sure that initiative took off the way it did.
Hmm.
So, those are some of the things. If I'm a patient wondering, what the heck does the medical society do to support me and
Yeah.
my access to care? Those are some really important things that have made a difference. The last would be virtual care, and we went to
Yeah. Oh
government,
boy. Yes.
mid-March 2020, when
Yeah.
the world suddenly changed so quickly, and immediately agreed with government, and the government agreed with us that virtual care was essential for us to continue to provide access to points of care virtually, and government agreed to ensure that would be paid. So, those are important steps that made a difference, huge difference, I think,
Yeah.
especially with respect to virtual care in the lives of New Brunswickers.
No, that's amazing. You brought the point up about virtual care, of course, because what an amazing game changer that was. I mean, and hats off to the members of your team, and of course your counterparts in the government who saw that, right? I mean, and I mean, overnight made sure that decisions were made. I mean, I have never seen a decision being made so fast, and a decision which has had such massive impact. I mean, as you know, I'm a psychiatrist, and the major impact that I saw on mental health was phenomenal. I mean, and we were all talking about this mental health tsunami and all that stuff. And as a psychiatrist, I can tell you, and somebody who's also uh, you know, um, being involved on the nutrition side of things, so I have an idea about how the mental health teams have also worked, and this the virtual side of things had ended up improving access to care. I mean, so during the difficult times of the pandemic, when I guess when more help was needed, I think more help was given, and in in a unique way. I think sometimes again people don't know, right? I mean, how much effort and thought because this wasn't an easy thing to do. I mean, a lot of things had to be put in place, and yet everybody moved at a very rational and fast pace to get that done. And no, and again, I've talked about this before, and since you're here, I want to thank you and your team, and of course your counterparts in the government for doing that. And that one decision, I can tell you with authority on that, has been able to make such a positive impact on people's lives. And just knowing that, especially in mental health as well, that access was there, and that has been a key focus, right? I mean, being a part of the executive board and so on, and and I've seen how everybody feels passionately about finding ways to improve access to care, and so that's been a cornerstone. I mean, one of the things, Anthony, that I've noticed also is that you know, yes, of course, you're part of the team of New Brunswick, of course, CEO, but but these provincial associations are also throughout Canada are also interlinked in the sense that they can meet and discuss things and so on. Right? I mean, and what has your experience been when you look at how things have been throughout Canada and how, in general, and how things have been here with us in New Brunswick?
Well, we have a tremendous network of medical associations across the country who are in communication on a regular basis, sharing experiences around things like virtual care, our experiences in trying to negotiate fees for physicians with different governments across the country. That's invaluable insight that we share and trade. I would say also, just in terms of Atlantic, there's a lot of commonality with our
Right.
sister provinces in the Atlantic region in particular, also in the Prairie provinces, but mainly in the Atlantic region, where we just find there's similar challenges, rurality, the challenges around recruitment are very similar, and we try to collaborate rather than compete with one another for
Hmm.
the finite number of physicians that everyone is seeking out to recruit for. So I think we have a great history of collaborating in that respect. We also work closely with the Canadian Medical Association, and they've been a tremendous partner in supporting our
Mhm.
work throughout the pandemic and prior to that as well, whether it's through our funding from them for wellness initiatives or support during the pandemic and the PPE program. So we have great relationships with all the provinces across the country, and it's a tremendous network that we rely on frequently.
Right, right. I mean, you brought up the Canadian Medical Association, and just want to point out that one of our New Brunswick physicians, Dr. Collins, was just the president, I think, just recently, wasn't she?
That's right. Yes, she was. In
Right.
fact, is a past president of the New Brunswick Medical Society and also served as chair of the board for a period of time.
Yes, yes.
Mhm.
No, I remember that. I mean, and then she was, of course, the president of the Canadian Medical Association as well. So that's
Yeah.
pretty cool. Now, how? I mean, what goes behind coming up with ideas, right? I mean, that's kind of baffled me. I mean, as a physician, for example, my training is one after one comes two, after two comes three, and it kind of goes on like that. I mean, and yet a lot of stuff that gets done through the medical society, that comes to the board and discussed and so on. A lot of that is around sort of thinking about things that might not necessarily be the most obvious, step forward. At least it seemed to be in the beginning, and yet 2 years, 3 years down the line, you realize, okay, that was a great idea, well done, and it's so. I've always sort of thought about where do these ideas come from? I mean, is there like a magic box that you guys come up with some idea and then everybody discusses it, or how does that
Yeah,
happen?
there's a box at the office. We have to feed it regularly. It's got to be plugged in, kept with a blanket. No, we have a tremendously creative group of people on the management team and our staff. The board of directors just bring a great energy and enthusiasm to the kinds of problems we all struggle with in the system. And then there are, we're so fortunate to have, 2,300 brilliant minds who are our members,
Yeah.
who are frequently contacting us with challenges, with opportunities, with suggestions on how to improve to be better. And that's certainly one of our great mantras is ways to find improvement, to
Mhm.
enhance, to not be ready to settle for complacency and to accept status quo. So our team embraces that approach to problem solving, and that's the, I think, magic mix when it comes to some of the solutions and initiatives we've undertaken over the years.
Right. I mean, no, I mean it's. I've always found that very interesting, and this. I just want to quickly go back to the, how the struggle in the pandemic. I mean, I'm talking as if it's the past, of course, but how that struggle at a very emotional level was happening in every household, right? I mean, throughout the world, of course, and so by definition, it was also happening in the physician household too, right? I mean, and there were some, challenges that emotionally physicians were going through, and the psychiatrists, of course. I mean, there were things that I mean, it was I could see that was difficult for physicians and so on. And did you notice that? I mean, do you want to tell us a bit about that, or did people reach out to the medical society about their emotional struggles?
There were several components to the struggles physicians were confronted with, um, during the early stages, the mid stages, and the later stages of the pandemic. I think not knowing, not understanding was very evident at the
Hmm.
beginning. Not understanding the infectiousness, the mortality, um, and how widespread the problem was, the virus was in the early stages. I think that was very disconcerting to many of your colleagues. There was also concern about their patients, and with hospital slowdowns and partial shutdowns in surgical departments in particular.
Hmm.
What that meant for their patients was of great concern. I think once we did turn the corner and start to distribute vaccines, however, um, the fear was present, but physicians felt like they were more protected with vaccines, and so that helped to give them a layer of security, protection, and assurance in their interactions with patients and the time they're spending in their clinical responsibilities. I think overarching, though, was the fear physicians had about bringing the virus home,
Right.
and
Right.
that being that burden of, I'm trying to care for so many people in my clinical duties, and then becoming infected and giving it to the people I care most of, why I work to care
Mm.
for them, and risking infection in your home when folks were not yet vaccinated. I think those were some of the greatest fears I observed from your colleagues, and that's a tough thing to hear. There were very few answers. Certainly, making
Yeah.
sure that PPE was available to protect them in their clinical responsibilities was a help, but that's certainly not 100% in terms of coverage. So those to me were the greatest fears, and I think now, there are varying opinions about how critical things are. There was the recent shutdown that we had in January and February, I think, really frustrated some of your colleagues, thinking that it was unnecessary. The
Hmm.
data would suggest that it made a difference. People did curb their behaviors. It reduced spread, it reduced hospitalizations,
Hmm.
and hopefully that's the last time that happens,
Right.
and physicians can continue to provide the critical care they provide to their patients who are very ill, and many who've waited longer than they
Yeah.
should
Yeah.
for critical care. So those are just some of the thoughts that I've observed over the
Yeah.
pandemic.
No. You're right. I mean, it's and again, I mean, it's not something unique to New Brunswick, but sometimes, as one sort of looks at things and looks back, it's kind of important to revisit. And you're right. I mean, I mean, for a big part of this whole thing, there was so many unknowns, right, about not knowing, and physicians are so used to knowing, right? I mean, that's what we do, like we're supposed to know the answers. So a lot of that sense of angst that was coming from not knowing what's happening, or because nobody knew. Or, for example, if somebody was asking a question, a patient, if they ask you a question about, and you had no answers because nobody knew again, right? And one of the things that I also thought that a lot of people struggled with was how, because of new information coming in, uh, what I found, disturbingly fascinating, of course. I mean, I say disturbingly because I don't want to sound like a sadist here, but fascinating because what was true in the morning wasn't true in the evening, right? So information comes in and it was like sort of like reacting to a live feed where suddenly, like, the government gets together, health authorities get together, medical site together, new protocol, and everybody runs to follow it. And then 2 days later, more information comes in, which is a bit different. So the feeling of, things changing and always feeling like you're catching up, right? And
Mhm.
and I think that was a bit frustrating without realizing that the very fact that the system was adapting was a good sign. I mean, what do you think about what do you think about that?
I totally agree. I think we've all really understood that science and medicine is just a series of gray zone decisions that you're
Yeah.
forced
Yeah.
to judge on. Very few things are black and white, and things are constantly evolving. Even when you think back to the rules around masking,
Yeah.
the early stages of the pandemic, we were told masks weren't necessary. Now look at us. Of course, that's changed dramatically.
Yeah.
It's incredible how quickly things evolve, how the science guides decisions, and you do have to think about the elected officials too. who
Yes.
have some really tough decisions they've had to make
Yeah.
over the last couple of years, who,
Yeah.
you know, are not often career politicians. They are
Yeah.
people who maybe were in regular jobs, 4 or 6 years ago,
Yeah.
who are
Yeah.
now suddenly ministers of the government
Yeah.
trying to do their very best as a citizen in a senior leadership role,
Yeah. I mean,
and didn't anticipate a pandemic when they took office. So, those folks are, you may not always agree with them, but I think at least the Canadian public officials really did their very best to follow the science and be evidence based. It's never perfect, and you can't be 100% right all the time.
yeah.
I would also say, what was happening in the States in the early and mid parts of the pandemic, that was probably not helping the public's sentiment towards,
Mhm.
government officials, with some of the commentary that came out of the U.S. that was confusing and not science based. So that probably added to the public's angst, I would say, at times.
Yeah. Yeah. No, I mean, I'm glad you pointed that out because I mean, like I mentioned earlier, I mean, the government policymakers have had an important role in healthcare provision in New Brunswick, and you're right. I mean, I don't think there was a crash course or preparation they could have done on let's work about how to deal with pandemics and to be kind of thrust there and everybody looking at you about okay, what's your decision now? I mean, you're right, and sometimes there wasn't any right decision, right? Because nobody could even figure out, I mean, what the extent of the problem or the nature of the thing was. So even for them, it was a catch up, and it must have been. No, I'm glad you pointed that out because at the end of the day, it has been a sort of a two-way partnership, right? I mean, I think we should definitely acknowledge the role that decision makers played in New Brunswick, no matter how difficult the decision was.
Absolutely. And, that tricky balance of public health interest and economic interest, I think a lot of people question motivation sometimes of the
Hmm.
government. People still needed to work. They needed to run their businesses, to sustain their incomes themselves. I think there probably could have been more supports to businesses that were struggling during some of the shutdowns. I think our government was late or unwilling to do some of those things that the federal government did. Um, that being said, hindsight's always 2020. So.
Yeah, yeah, yeah. And there's so much going on, right? I mean, the point is that the way I look at it when I look back, and I'm not trying to, give any reasons for anything, but when you look back, you see that it was like a series of concentric circles, right? I mean, layer number one, layer number two, layer number three. Just the whole thing was like multifaceted. And what do you choose to focus on? And guess what? I mean, it was like focus now, make a decision now. I mean, that's how the urgency of the whole thing was. And so that definitely overall was. But again, I mean, it was I think collaborative efforts that made a difference. So as you look forward from here, um, and and in the unique position that you are in, and getting to see behind the curtain, so to speak, how do you see things panning out? I mean, can you look at your crystal ball and tell us we're going to be all right, Anthony?
Well, I think we've really managed through the pandemic better than many. Um, and I credit our citizens for that,
Yeah.
uh, first and foremost, because when the government said people stay home, people stayed home.
Yes.
And they were adherent to the guidance from public health. They were willing to put others before self. They wore
Mm.
their masks, they washed their hands, they stayed distant. So those are things that made a difference. The death toll being over 300 right now is certainly a tragic loss, but could have been far worse. I think if citizens hadn't been as adherent. And I expect people, despite the frustrations we see from people with the restrictions that we've had over the last 2 years, I expect people will still be adherent as we look to lift restrictions on the 14th, and that folks will take steps to protect themselves and others, because that's what New Brunswickers do. Um, I think, what comes next, it will be a slow withdrawal maybe from the pandemic. There will still be cases. We want to certainly continue to encourage folks to get vaccinated, either first or second shot. And if you've had those, then get your booster. We certainly would like to see a higher rate of vaccination of the booster. And despite government telling us we don't have to wear masks, I certainly will be, and would encourage others to do the same, out of protection for others, protection for yourself and your family.
No, I think that's a great point. There's one thing, and I know in the interest of time, but there's one thing that I, on a personal level, that I wanted to ask you was that, I mean, for somebody who's, you've been around for a while. I'm not saying you're old, but you've been around for a while. You've had your ear to the ground and eyes behind the curtain, so to speak. And at a personal level, what has been your, most sort of satisfactory moment, or something that you look back to and you feel, what, I'm bloody happy about that. And in the same way, in anything that one might say has been a regret, where you felt that, despite my best efforts, would you like to tell us about that?
Mm-hmm. Well, certainly, the improvements in physician services really are something I'm proud of. Our wellness program, how doctors can access us. We have a more robust, capable team to respond to their concerns and advocate on their behalf.
So I think we've got a bit of a static there, Anthony. Kind of lost your connection for a bit. The last I heard was to be able to advocate on behalf of physicians.
Yeah. Sorry about that.
No problem. And so
yeah.
that was your the thing that you find satisfying, and rightly so, because a lot of changes, of course, positive changes have happened ever since even I've been able to see. So you're right. And
in terms of the most challenging aspect, I think our continued difficulties with recruitment, with retention, with primary care access. It's getting worse, not better, in all those respects. So those are not things that we have full control over, but we certainly are doing our best to influence them. I think the elimination of billing numbers was an important step forward, and recruiting to fill the new positions that are being created presently is critical. So plenty of work to do, and no shortage of challenges ahead.
No, you're right. But you know what? So I know that you're busy and finding time on and I appreciate this, and thank you for doing this. And it's always been something that I wanted people to see, that because as physicians, people see that, okay, Dr. So and so did this and that, and a lot of the times, the public don't realize that a lot of hard work is going on behind the scenes about bringing sort of everybody forward, like challenging status quo in more ways than one, right? I mean, and thinking about how to further things which might appear to be basic, but access to care, for example. I mean, it's such a huge problem. But as a general member of the public, when I hear this conversation, I'm going to be a bit more satisfied that, okay, at least someone's thinking about it. Maybe there's no 100% solution here, but okay, thank God someone's thinking about it. So from that perspective, I think this was helpful. Any parting words of wisdom as we draw to a conclusion?
No, thank you for this, Nachi. I appreciate the opportunity to chat with you. Always have enjoyed our friendship and collegiality. You're a great leader in your community. You do so much for your patients, but also your medical colleagues as a leader. And this is just a great initiative. So thanks for the opportunity today.
That's very kind. Thank you. And both our behalves, of course, thank you to everybody who's been listening and watching this, of course. So take care, Anthony. We'll touch base again.
Thank you.